12 years ago, tooth 11 underwent endodontic treatment and was restored with a crown featuring a complex shade, dark, heterogeneous, with individualized transitions between tones. The reason for the visit was a sinus tract located approximately 10 millimeters above the crown projection. The radiograph showed that the root was short and there was pronounced inflammation, making apicoectomy impossible. Therefore, extraction was indicated. The extraction was performed as atraumatically as possible in order to preserve the crown intact. Subsequently, it was used as a temporary restoration to maintain aesthetics during implant osseointegration. Immediately after extraction, a 13-millimeter implant was placed without the use of a surgical guide. The control radiograph showed that the implant position could have been improved. However, in this situation, the new CRESTFIT multi-unit provided an effective solution. The CRESTFIT is placed. A 3-millimeter multi-unit is inserted into the implant, and the correct position is selected by orienting to the projection of the plastic carrier, which indicates the future sleeve direction. We need to make sure that the hex connection of the multi-unit is fully and accurately engaged in the implant while maintaining the selected orientation. The multi-unit is fixed using a hex driver. The carrier is removed and the multi-unit is definitively tightened. Next, a sleeve for a single crown is installed. The sleeve has an identical seating geometry, allowing precise and unambiguous positioning on the multi-unit. We then proceeded to the next stage, preparation of the temporary crown. We worked with the extracted tooth. The root was carefully separated and the coronal portion of the tooth was removed from the metal ceramic crown. The crown was then thoroughly cleaned of cement with mandatory cooling to prevent overheating and damage to the ceramic. We try in the crown. Fixation is planned using flowable composite, which would allow easy removal of the temporary restoration in the future. An access opening was created on the palatal side. The opening must be sufficiently large to allow unobstructed light transmission. This is critically important as metal does not transmit light. Composite polymerization in this case is possible only through the created window. All procedures should be performed under cooling to prevent ceramic cracking. The crown is securely fixed and polymerization is performed from both sides. After that, the restoration is unscrewed and the resulting voids are filled, followed by final finishing and polishing. At this point, it is especially important to emphasize the advantages of working at the CRESTFIT multi-unit level. If this procedure was performed on a conventional angled abutment, each try-in would require subgingival manipulation at a depth of 3 to 4 millimeters, traumatizing the soft tissues. This would cause discomfort, inflammation, and delayed healing. When working at the multi-unit level, the seating interface is located approximately 0.5 millimeters below the gingival margin. As a result, soft tissue trauma is minimized, try-ins are comfortable, and the gingiva can form naturally around the restoration. The next stage is planned in 3 months, once the gingival contour has matured around the temporary crown. The treatment performed, its sequence, and the selection of components simplify fabrication of the definitive restoration and make the outcome more predictable. The temporary crown was intentionally fabricated slightly shorter than the adjacent tooth to completely eliminate loading on the implant. This difference is virtually imperceptible visually. As a result, the patient leaves with the same appearance she had before treatment and without any aesthetic compromise.